In this video, we'll talk about conductive and sensorineural hearing loss. To diagnose these, you can do a Weber's test or a Rini test. So let's talk about those first. In a Weber's test, you're going to take the tuning fork and then put it in the middle of the forehead here. Now, let's say I have hearing loss in this ear. Once I put the tuning fork here, you're going to ask the patient, in which ear do you hear the noise better in? If I hear the noise better in this ear, that means I have conductive hearing loss in this ear. Let's say I do the test again in another patient and they say they have hearing loss in this ear, but they're able to hear the sound better in this one. That means I have sensorineural loss in this ear. For the Rini test, you're going to take the tuning fork and you're going to place it on the mastoid bone behind their ear. And you're going to ask them when they stop hearing the noise. When that happens, you're going to take the tuning fork and hold it out here next to their ear. So you're testing air conduction and bone conduction with this. So a patient comes in and they have hearing loss in this ear. And I'm performing a Rini test. If they have conductive hearing loss, then the bone conduction will sound better than the air conduction. If they have sensorineural hearing loss, the air conduction will sound better than the bone conduction. So sensorineural hearing loss will occur if there's damage to the nerve or if you have loss of hair cells. For example, presbycusis is hearing loss that's associated with aging. You'll have loss of hair cells in the cochlea over time, and you'll first lose high frequency sounds. Patients will complain about not being able to hear in a noisier crowded room, for example, and this will cause them to socialize less. Let's say that you're chronically exposed to excessively loud noises. For example, if you go to concerts a lot or if your job entails you being around really loud, noisy machines constantly, that can cause irreversible hair cell death in your cochlea, and that'll also cause sensorineural damage in your ear. Some ototoxic medications can also cause sensorineural hearing loss. For example, aminoglycosides, cisplatin, or high-dose aspirins. Also remember, with high-dose aspirins or aspirin toxicity, first you'll have respiratory alkalosis, and tinnitus can also occur during this time, and then that'll progress to metabolic acidosis. Now let's talk about conductive hearing loss. So this usually occurs when there's an issue with bones, or maybe there's like some foreign body in the ear. Some infections can also cause it. For example, otitis externa or acute otitis media can cause conductive hearing loss. Another example of conductive hearing loss is otosclerosis. So this can be caused by either an overgrowth or a stiffness of the stapes bone in the ear. This is most common in younger people, especially women, and unfortunately this can also progress during pregnancy. Cholesteatoma is another cause of conductive hearing loss. This will present with granulation tissue and also squamous cell epithelium or keratin debris in the ear, which will cause a retraction of the tympanic membrane. Patients will usually find out they have this after they have an ear infection and they're treated with antibiotics, but they're still experiencing hearing loss and continued drainage from the ear as well.